Global and Inclusive United Nations Platform on AI. Organized by the International Telecommunication Union, the United Nations Agency for Digital Technologies, in partnership with 50+ UN sister organizations and co-convened with Switzerland. The goal of AI for Good is to unlock AI's potential to serve humanity. In today's AI for Good event, we are counting on you to use the live video wall feature to ask questions and post comments to help create an engaging discussion. We encourage you to stay until the end to chat, connect, ask questions, and network with our distinguished facilitators and world-class AI experts in the neural network. It is now time to kick off the session and welcome our first speaker. The floor is yours.
Good afternoon. Welcome to our online participants. My name is Noelia Martinez Huerga, and I'm in charge of international projects in emerging technologies at Digital Policies Secretariat of the Catalan Government, Generalitat of Catalunya. The goal of today's webinar is to share knowledge, raise awareness, and encourage discussion on AI and healthcare. And we would like to thank AI for Good Network for hosting us today. So the title of today's presentation is Promoting Participatory and Responsible Approaches to AI Adoption in Healthcare. AI holds great potential to transform healthcare, and the Catalan Administration is committed to using it as a support for both clinical care and health management. A responsible and sustainable approach is essential, one that guides a deep understanding of health problems and unproven practices within the sector. So today, our guests are the Secretary for Digital Policies of the Catalan Government, who has prepared a few words for us, Maria Galindo. And also we have the Professor Albert Sabater Coll, Serra Húnter Associate Professor at the University of Girona and Director of the Observatory for Ethics in Artificial Intelligence of Catalonia, OEIAC, and will expand on its ethical foundations when he explains the topic, hybrid on AI and healthcare. And afterwards, we will have the case of ABCDx, a company that is developing a rapid mobile neuro-vascular diagnostic solutions that will be presented by Juan Gonzalez Fraile, head of innovation of this company, which will serve as an example of this topic that we have today. So ultimately, we advocate for a care-centered vision following ethical principles that go far beyond efficiency and operational performance so that we ensure trust and impact on society. So don't hesitate to ask questions. And now we would like to give the floor to Mrs. Galindo, the Secretary for Digital Policy.
Welcome to this webinar on AI and healthcare. We look forward to learning many things and to sharing a lot of knowledge around how AI is shaping our economy, our society, and even our communities, especially in the field of health tech and how technology is transforming how we consume health and how we deliver more services related to how we can improve our healthcare systems. From Catalonia, we have been launching a new AI strategy, Catalonia AI 2030, with the aim of preserving ethics on AI and to transforming our economy and our society, delivering an AI that leaves no one behind and that serves all the sectors of our economy. I want to thank especially the ITU for delivering this session and also to the Observatory on Ethics on AI from Catalonia and PickleTech, who have been working so hard to deliver the webinar, and we look really forward to collaborating with you again. Thank you so much.
Well, thank you all and welcome. And now we would like to give the floor to Albert Sabater, who is our professor joining us today. Good afternoon, Albert.
Good afternoon. Very glad to be here joining you in this session. And thank you very much to ITU for giving us the chance to present some of the work that we are doing from the Observatory for Ethics in Artificial Intelligence here at the University of Girona as part of the Catalan strategy on AI. So what I'll be talking about in the next 15 minutes is something that very much relates to how to apply responsible AI using tools that very much resemble checklists based on principles, indicators, and observables. And we do that using a tool that is very much focused on health. And so what we are going to explain is something that we hope it is useful for those who are health practitioners, and particularly for those who are thinking about using AI systems currently, by taking into consideration a set of principles and as well as evidence of indicators and things that we can observe whether or not we're doing the right things. So next, please. There is, generally speaking, we have an idea on how to promote AI in the health domain, but we are sometimes not aware that there are a different range of tools and tools that in some cases are very necessary, tools that are very much to self-assess what we are doing in the form of a questionnaire or a checklist. And so what we do from the Observatory for Ethics in Artificial Intelligence is to encourage all the agents that very much take AI as a way to implement some solutions to think about the current regulations and the current things that have to do with ethical requirements so that they apply these diligently. But we are very aware that in many cases, this is complicated, it's complex, it's sometimes a great deal of paperwork. And so what we do is we facilitate with bringing forward a solution that somehow it encompasses those things that are needed in order to think about the very basic, but also the more sophisticated things that almost all AI applications need to be or need to have in order to have some sort of progress that relates to responsible AI. So the idea here is very much to help users to know if the system complies with legal and ethical principles. And we do that in a manner, as I said, that is simple and straightforward, even though some of the things can be very complex. Next, please. So the idea very much is that the users of AI systems that very much or that basically use these applications in the health domain take into consideration principles, ethical principles that relate to the different things that are also important and are basic structures of ethics, applied ethics, but at the same time conform a range of ethical guidelines and legal aspects that need to be considered. And in order to simplify those things that can be incredibly complex, what we do is we systematize, we basically provide a tool that is based on 7 principles that are resembling very much those that are related to the consensus in the academia, but also in the international ethical frameworks. And then we look at these issues by questioning different aspects that go, as you will see in a couple of minutes, that go from transparency to privacy to sustainability. And we do that by asking questions here in the particular tool that is specific for the health domain. We have more than 90 questions that can be used to actually see whether we are making progress along the lines of these 7 ethical principles. And at the end of this process, what we get is some sort of snapshot, that allows us to see whether or not we are doing well in this application of the 7 principles of the PO model. But also we provide, in addition to the more sort of general result, we also provide 2 more things. One is a risk matrix, which you will see combines whether or not we are doing the right sort of progress in relation to the current AI legislation in the European Union, but at the same time, whether or not we are saying that we're going to do something in the short term, in the midterm, or in the long term. And then we basically are able to give some indication about whether or not this entails some higher or lower risks. At the end of this process, we also provide a list of things that can be considered as points for improvement. And this is particularly important as we consider that in the application or even in the design of some of these AI systems, we need to consider that some of the things that we do need to be by design ethical, but also legal compliant. But when we use them in particular contexts, we will see that some things perhaps are not foreseen. And what we are trying to do is to remind of some of the critical issues that need to be taken into account. Next, please. So which are these 7 principles? So basically, we are talking about things that relate to transparency. Transparency is a principle that is also very much related to explainability. We need to be able to comprehend what we are doing, how we are applying some of these systems in a manner that all the parts involved really comprehend, really understand the things that we are doing, but also the objectives, the things that we are trying to accomplish by using AI systems in the health domain. We also try to explain the importance of having autonomy that can be explained in different ways, autonomy that we want professionals to have, even though they might be using systems that really automatize some of the tasks and some of the processes. But we really want to encourage through the application of this tool of the importance of this human-centric approach, whereby we want to augment, we want to make sure that those professionals don't get in sort of a position of being sidelined by the technology, but they really repurpose this technology or use this technology in order to acquire greater autonomy, not less autonomy. These systems need to be also sustainable, socially as well as environmentally, and therefore we encourage professionals to use those systems that are more efficient in terms of these two these two issues that are very much important in the progress of sustainable development goals. But also we are looking at things that have to do with responsibility and accountability. By responsibility, of course, we are always taking into account that health professionals have legal but also moral responsibility. This is not something that we can transfer to machines, and therefore there are some elements that we need to remind or we need to inform those professionals about these particular issues. And of course, there are elements that have to do with data and privacy and more traditional sort of elements in relation to technology, such as security and non-maleficence. We need to make sure that when we use AI systems, we do more good than any sort of harm. And we need to sort of always provide these issues upfront. We need to provide evidence that this is actually the case. And last but not least, we need to make sure that whatever AI system we use in the health domain is a system that provides justice and in equity terms, or in terms of making sure that everybody gains from the use of these systems. The results are not biased, they're not really sort of harming or discriminatory for particular individuals or groups of the population. So as you can see, the 7 principles encapsulate a range of things. And in some cases, they very much relate to each other. But the important thing is that even when we have dilemmas, and some of the questions are presented in terms of dilemmas, we are able to gain knowledge as well as expertise through the use of the PIO model. So next, please. So it's very important also to highlight that the PIO model is not designed sort of away from the very core elements of social justice and the core elements of human right approaches. And as you can see in the backbone of the PIO model, we have a range of very important texts that we have basically reviewed, and we review it in a way that we can ask questions that tackle some of the very important aspects of global and regional consensus when it comes to human rights, but also when it comes to things that are in the contextual and the regional, sort of more regional point of view in terms of social charters. So here you got just a sample, but a very important sample of the documents that we have reviewed, but also we have translated in terms of questions that we remind the AI system user, deployer, intermediary, the basically the agent that is using AI systems, that these are things to take into consideration and to be reminded on a constant basis. Next, please. So how does this, in practice, how does this model work? So we're going to go through some slides now, and I'll show you very briefly the key features so that you can at least have some takeaways. And then, of course, we are more than happy to explain this in greater detail through other types of sessions. Next, please. So basically, first of all, you will see if you go to our website, www.oeiac.cat or CAT, you will see that we have some general models, but also these more sectorial models, the sectoral models. And one of them in particular is this health model that we are talking about today. And here you will see that you have access to these models as well as some resources that have to do with legal catalog, on how to write contracts specific between customers and providers, as well as the report that sort of justifies the importance of having these sort of tools. Now, next, please. We have, if you can see the sort of image, you will have here just a sample of what you can encounter when you start the checklist with the health model. And it's one in which, first of all, we have, after agreeing the terms and conditions, you have a set of questions in which we explain the importance of having these questions. So we have reference to all the text that we used in order to come up with these particular questions. In this particular one, we are asking, do you think that you have established the level of transparency and explainability that doesn't jeopardize the security of your AI system? So here you got some references that basically relate to this specific question. These references, we got all the links, and this serves as a justification for having this particular question, because at the end of the day, we also want to show that this is one way of complying with the current legislation, but at the same time with international ethical standards that ask us to do something, some steps towards this particular issue. We are also providing examples, some examples that can be useful in order to think about these particular issues. And then the respondent has the options of giving some information about whether they will do something in terms of an action, if they will be doing an action soon, if this is very likely or not. And if they consider this as something that when it comes to the use of AI system, there is a probability of occurrence, if this is something that is very likely or not to happen. With these sets of information, we can basically conform. We can come up with the risk matrix that we were talking about earlier. And in some cases, if the question doesn't apply or is something that doesn't relate to what we do, we can say it doesn't apply. If we are doing something about it, we can click yes. And if we're not doing something, then is when we have to provide some information in these boxes, number 5 and number 6. Okay, so next, please. Now, the results. Very briefly, I'll show you what you get at the end of this process. So basically, in some cases, people who are using AI systems or evaluating AI systems or deploying AI systems might be answering 60 or 70 or even more than 90 questions. And at the end, we get these 3 sets of results. So the first one, please, next, is the general snapshot that I was talking about earlier. It's a snapshot in which we see the level of which we are actually doing well or not so well in terms of percentages for each of the ethical principles. And we use this color scheme to emphasize that green is that we are doing pretty well or very well, whereas the colors that are closer to red or white basically translate into that we have to do quite a lot of work in order to comply with the issues that we are putting forward. Here in this very example, or in this example that shows the 7 principles, just to give you an indication, but it's just an example, we would be doing quite well in terms of safety and non-maleficence. We would be doing quite well in terms of privacy. But when it comes to sustainability, we should do quite a lot of work because, as you can see, we are well below 50%. So that means that in the sort of questions that we have answered, in this particular case, 5, we have 40% of yeses, but 60% of no's. This is just a sample, but just to give you an indication of what we get in this particular first step of results. Next, please. The second set of results is a little bit more interesting in terms of knowing what to do and why we have to do something as soon as we can. Because when we say that we're not doing something in particular, what we, as you remember, we ask whether or not you are likely to do something, but also we are translating this into how this might be actually some sort of risk if we think about the current AI legislation. What we do is we say, okay, we are capturing through the answers of those users who are using the PO model, whether they will be doing an action for each of these issues that relate to the ethical principles. And then we say, okay, but if we are prepared to do something, how does this relate to the low or high probability of doing something, but also at the same time with the level of risk by severity that is linked to the AI Act, so the legislation currently in place in the European Union. What you see here in the screen is that if we are not very much interested in doing something, and that represents a high probability of getting some sort of risk, then we will remind those who are doing this checklist that we should be doing something because we might not be complying with the legislation. At the same time, this represents a very high risk of harming users or harming those who are even using the AI system. So those sort of red cells that you can see in the lower part of the matrix just give you an indication of the things that we should be doing. And as you can see, we got here in some cells, we got 4 things or 2 things, in some cases 0 things, but these 4 and 2 and 2 in the sort of right part of the cell of the matrix are very much an indication of things that we should be doing as soon as possible. Whereas those things that are in the green part are things that we need to be doing something, but represent a low probability or low severity of risk. So we should think about it, but it's not in the priority agenda. It's not something that we should increasingly worry, but we should do something, but not immediately. Now, next, please. So the final part in terms of results from the metrics that we get after using the checklist have to do with the things that we give you, so sort of the homework, the homework that you take away with you, with the issues that you have basically responded as not doing something. And then we remind you that these are things that you should be doing something, but at the same time, we classify them based on the previous matrix that you've seen. And at the same time, that's something we do through the color scheme, but at the same time, on the right-hand side column, you see that there is all the justification. So this is not just us saying, okay, you should be doing something because we personally believe that this is important. We don't do that. What we do is we base these sort of these issues or points for improvement based on the current legislation, on the ethical standards that are very much in consensus, and the things that we have seen in relation to either legislation in sort of the European Union particularly, but also things that might actually relate to the more contextual legislation in place. Here you will see that we have, for example, the Royal Decree from Spain, from the Spanish Clinical Studies Register, or things that are very much regional. So the more kind of local aspects of legislation. Next, please. So in addition to all these things that we very much like you to use, we have other resources that are available through our website. And I want to show you 2 in particular that I think can be very attractive for all sorts of users in the health domain. The first one, next please, is the legal catalog. So in order to basically have a tool like the PO model, one has to review a great deal of legislation, a great deal of sort of text that in many cases are very complex. So our team has done a great work in order to review all these texts, but also to classify these into each of these 7 ethical principles, so that it is much easier, I mean, to use and to find what we are basically talking about. You can see that some of the texts are very much relating to the legislation in a particular country, but we can do these sort of things for other contexts. But the important thing is that we have the catalog for people to see very specifically which article of the legislation we are referring when it comes to a particular issue within each of the ethical principles. And at the same time, we relate comprehensively each of the principles, articles with the questions in our PO model. So in some cases, it's just one way of just checking, one particular thing. And in some cases, it's a great deal as a source to make sure that what we're asking in our model relates to all these sets of information. Next, please. And then finally, the other important research that we offer, and this is particularly useful for all sorts of startups, companies, also for hospitals, for health practitioners. When it comes to establish a relationship between different parts that are using or want to deploy AI systems, it's important to, from the very start, to have a contract, an agreement that respects the current legislation, but also complies with the current legislation. But at the same time, it takes into consideration these ethical principles that we have agreed very much globally, but also in places like Europe. And one way to translate this into contract is by facilitating information for these agreements. So these are kind of sets of information that you can use in a pro forma contract, and you can use it in a way that is comprehensive. So for each of the principles, you can copy these and then tailor-made these elements that relate to transparency or justice or safety, and then the specific clauses. You can basically get these and amend as you like. But having these as a framework, we consider that it really helps to establish these agreements in a way that is fully compliant with the legislation as well as with the international ethical principles. So next, please. We very much welcome you to visit our website. You will find not only these resources that I've talked about today, I'm just giving you an overview of three. The main one is also available through our website. We also have other tools that relate to other sectors, but today is a day to highlight the importance of applying these checklists in the health domain. And we are more than happy to give you more details. If you go to this website, you can also contact us, and we can basically arrange a meeting to give you a great deal of information about how to apply the PO model as well as other resources. Next, please. So thank you very much. And as I said, we are more than happy to welcome you through our website and to contact us whenever you consider. Thank you.
Well, thank you very much, Albert, for this presentation. It was great content. And please, we encourage you to ask questions and comments, and we will read them loud at the end of the session. And let's see if we can answer some of the main topics that you may arise. And then let's move to the next participant, Juan Gonzalez Fraile, Head of Innovation at ABCDx, co-founder also, and Director of PickleTech. He's also an example of what Albert was mentioning, and a startup that is applying PO model, and also he's aligned with the new strategy from Catalonia AI 2030 here within the Catalan ecosystem. Thank you.
Thank you, Noelia, for the introduction, and Albert for the nice presentation of Model PO, and good afternoon, everyone. So for the rest of the seminar, I'm going to focus on describing a real use case, the case of ABCDx, in a very sensitive context, which is that of ambulance care. So it's a pre-hospital setting. And I will focus mostly on which are the particularities and challenges, and also how we've approached those in alignment with those principles that have been introduced already. But to begin with, let me introduce the clinical context of the solution, because when we are talking AI for healthcare, like making sure that the solution is going to be aligned with a real clinical problem is one of the key factors. So the solution by ABCDx is on strokes. strokes have a major incidence in the world per year, so the numbers are daunting. It comes to from 12 to 15 million people in the world have a stroke per year, out of which a third of them are mortal, and then another third come with disabilities. And the complexity of solving this issue has meant that there are a lot of campaigns for awareness, for prevention, but also to try to improve the efficiency of how our healthcare system respond to a stroke. And strokes are so acute because for the most severe ones, either the patient gets a treatment within a very short window, which is only a few hours, or the consequences are devastating. So that you can see the complexity of what's the response to a stroke, we can have a look at the next slide, where it is like a visual summary of what is the current standard of care when a patient has a stroke. No, it starts with hopefully and likely some sort of call to an emergency setup. You can think of like an ambulance, for instance, after a patient has a suspicion of a stroke, or someone that's with a patient has a suspicion of a stroke. And then after a first assessment that is done by the healthcare professionals within that ambulance, within that response, there is a first transfer, usually to the nearest hospital where there is a CT scan facility. So it's advanced imagery to determine what is the exact or the type of stroke that the patient is suffering. If the patient is suffering one of the most severe type of stroke, which is the large vessel occlusion, so it's a ischemic stroke where there is a blockage on the blood flow in the brain, we have a life-saving treatment, which is the thrombectomy. But usually that treatment may not be in the same hospital facility where the CT scan for the assessment has been performed, which means that then the patient is going to be redirected or transferred to that other hospital to get hopefully the thrombectomy that is going to save the life of the patient. But what's usually been said for strokes, time is brain, because for every minute that a patient is suffering that ischemic stroke, there are almost 2 million neurons that are being lost, which is directly translated into a reduced probability of survival, and also prolonged time means also like a bad outcome when it comes to disabilities and everything that is related to that. So as you can see, this is the reason why there is such a huge campaign on every step of that standard of care response, from prevention to how to improve, for instance, imagery. There is also like a bunch of AI innovation, a lot of AI innovation going into imagery there, also when it comes to treatment. What we are doing with ABCDx, with LVO Check, is to try to provide something in the ambulance that can speed the process, make it more accurate and make it more efficient. So the solution that I'll be using as a use case for the discussion on AI for healthcare, it combines a lateral flow assay, so a point of care test that is able to detect 3 proteins in a rapid way. So it's a rapid test that is then combined with a digital site, which comes with an app that the ambulance personnel are supposed to take, and that facilitates both the reading of the test, but also the integration of the AI as a clinical decision support. This means that in roughly 10 minutes, then the healthcare personnel would have the chance to use that information as a support to decide on where is best to send the patient. And for the cases of LVOs, which are the ones that we are targeting here, the ones that are having a large vessel occlusion, that may mean to be directed directly to a center that has a thrombectomy facility where they will still get the CT scan. So it's not a replacement, but the thrombectomy is going to be close by in case that is actually needed. So the potential of the solution is for saving time, and then that is directly translated to improving outcomes and helping also the healthcare system to prioritize patients. So if we go to the next slide, then this is the technical components that you'll see that there are years of research that went into the lateral flow test. So it's deep tech, it's translational science. So there are 3 proteins that are related to neurovascular side of the patient that are related to different strain and damage to the brain and the heart. And then the main tech component that is going to be the focus of the rest of the talk is on the mobile app, the digital component that contains the AI the algorithm part that provides that decision support. And finally, there is also a web portal, which is more for data governance, communication, and allowing easier integration with how the healthcare system work. This is a representation of the solution that we are building, but just so that another important thing when we develop solutions for digital health is scalability, and scalability not only in the sense of being able to serve more patients, but also in the scalability of the approach. Let me just tell you that flow that goes from an initial assessment, advanced imagery through a CT scan, and then treatment is not unique for strokes. The same type of flow in our standard of care also happen in other conditions. So this is what will be shown in the next slide, because we are talking here strokes, but it's also about pulmonary embolism. It's also about traumatic brain injuries. All those come through a similar logic. There is a first assessment, advanced imagery, which means waiting time, resources, or transfer. And then there is a decision on the treatment, which may mean a bit more of waiting time or time for treatment. And that approach of trying to provide the support in the early assessment to reprioritize the resources for the CT scan and also the easier access to treatment is something that can be applied also in different directions, but I'll focus on strokes for the rest of the slides. So coming back to the next slide, going to the next slide, please. What does here having a deployed model means? Subset is a decision support that interacts with the user through a mobile app. So for the ones that we may come from a more stronger or technical or engineer background, this could be directly translated into MLOps, which is the next slide. No, one could think that what we have here is that a deployed model means we have data sources to do some AI modeling, which is still sort of a black box in this slide. Then, of course, if there is a deployed model, we should have a monitoring way to monitor performance and also a way to monitor usage. And then usually on that simplified description of what's machine learning operations, there would be sort of an orchestrator assessing how is that monitoring going and deciding if there has to be a change on the deployed model or not. This is theoretical, but then when it comes to a healthcare solution, certainly there are some changes, bottlenecks, challenges that make this picture slightly different, but also way more rich. That's what's shown on the next slide. So instead of that, this sort of still black box schema for MLOps, here it's one that tries to depict more specifically what is happening when we develop one sort of AI solution to provide that decision support. So I'm going to try to comment on some of the main differences, which are related to some of the main challenges that we face when we are developing that solution. So the first one that you'll see is that data sort of bucket has reduced its size. So that it's very particular for the case here, but it's also common for many other cases in healthcare. So maybe when we think about AI for health, sometimes we may think about radiology, imagery, thousands and thousands of images, deep learning, a lot of computation when data is not such a big issue. When we are come in scenarios like this one, where already data collection by itself is innovative because it comes through a rapid test, one of the main challenges that you find is that data has to come from a clinical study, which means that at the end, data sources are reduced. They are scarce. So the main implication of that is that the whole block of AI modeling has to become as transparent as possible. So here is when we're going to start to talk data governance, representativeness, and understanding which are the biases that show on those scarce data sets that you can use for training is key. And it's not only key for the OEIAC, it's actually key just to be able to prove any evidence and to be able to develop something that makes sense for the data that we have. When the scenario is data scarce, having a full control on the scientific building blocks of what learning and what developing an algorithm means is key. And it's key to do that development together with the domain expertise that it's able to understand that with not that much data, domain-driven construction of which variables have been proven in the past in the medical literature to be carrying predictive power for instance, here LVO assessment, or for what's the target of the AI solution is key, which means that again, the combination of different stakeholders while the solution is developed is going to be key to have something that can perform with a high enough performance so that it can have a chance to impact on the healthcare system and change that standard of care by improving the triage of LVOs as we are talking here. This is also translated in another technical component, as I've said, which is, can you go back, please? Which is on everything that has to do with statistical learning, design, validation is important. One of the key issues here is to derive evidence. Then when it comes to the right of this diagram, you've seen that there is no longer a orchestrator here. This is a strongly regulated field because at the end, this is going to be integrated as an in vitro device for diagnosis. So it has to follow regulations as well as the OEIAC, which means that how that orchestrator work is very different to what one could have thought from an engineering perspective where AI may be updating fast. Here, that is not the case. But also there are other differences we have to take into account here, like what it's been trying to depict by the fact that you have a user interface there in small, is that the development of the solution has to be really conscious of who is the user. Like who is the user in the context of an ambulance setting means that the user has to be focused on treating the patient. So the user flow has to be smooth. The interactions have to be minimal. There has to provide some autonomy to the healthcare professional. And at the same time, what is shown as a result of the artificial intelligence decision support, but also how it is shown is key because the user, because that information has to be completely adapted and informed by what that type of user is going to interpret so that the support to the decision can be effective and cannot be misleading, and it can take into account the different type of users that are there. Then while building the solution also, there are some other components that have to be taken into account, also which incentives there are on the responsibility or attached to the responsibility that the user is going to have on the decision. And also, like I've been mentioning, representative mitigation bias, which are very related to transparency and explainability. And then for sure, when it comes to monitoring, it's all about now with the OEIAC to build a clear system that is able to detect model and data drift, but also to have some human oversight. And coming to the next slide, most of those components are technical, because it talks about fundamental aspects of machine learning, statistics, data analysis, and also IT systems, cybersecurity, etc. But I've tried to emphasize many of the challenges that we face on the development of these solutions are also quite aligned with those ethical principles that Albert was describing, showing model PO, because we are talking here transparency, we are talking explainability, we are talking like safety and no maleficiency. We are also talking about the dilemma there maybe between responsibility and performance, and those type of dilemmas. And this has to be, like as I've said, like that machine learning operational schema completely changes when we have to take into account that this is regulated, it has to be certified, and what's to be certified needs to be taken into account that it cannot be as dynamic as someone would hope. So those are actually the three pillars of responsible AI, and this is why in healthcare, in such a sensitive scenario, to get to a solution that can impact the life of the patients by providing, for instance, like here, a triage, like a support to where LVO potential patient has to go, have to be aligned with that. Next, please. Yeah, and this is like I put there also the resource that Albert was talking about. So there you have more resources in case you want to look for more details. Otherwise, we'll be happy to get questions. Thank you.
Well, thank you very much, Juan, for this explanation today regarding all this application. And we have people joining from different parts of the world. So we encourage them to participate and ask questions because they come from different health models. And it's important to have impressions for different regions and countries. So I would like to address a question to both of you. Basically, I would like to know what can we do so that the startups like the one that Juan is here presenting today, Albert and Juan, taking into account your experience, can really be proactively using these models, so that they see that it's not a support tool, it's something there that has come to stay and that will give them, more opportunities with business and with the patient experience that we all have on a daily basis, I would say. Thank you.
Shall I go first, Juan? Okay. Well, I think we are at a point in which we all want AI to be a normal technology. And in order to have AI as a normal technology, we also have to normalize, we have to standardize some processes, and we have to make sure that in order to give to have this relationship with technology, but also to give trust to people who use this technology, we have to undergo these sort of processes. So we have to be knowledgeable about ethics. We also have to be knowledgeable about how they comply with the current legislation. But we also have to make sure that people do not sort of have a huge amount of work. We have to facilitate these sort of things in a way that they can go through relatively easily, even though in some cases this will require some actions, of course, because at the end of the day, what we want is this technology not only to be normal, but to be even better than it is in many cases. So I think this is the main general message. But as you can see with the presentation from Juan, this is not fictional. This is not something that is kind of an ideal. This is happening, and some people, some companies are doing this sort of thing. And it's very important that we highlight this issue, that it is something that we can do, and we also, by doing that, we go towards some sort of area in which we are also giving value not only to the technology but also to those users of this technology. To make sure that they trust the technology, they use it better, and at the end, the solution is, in some cases, saving lives, as we could see with Juan's presentation. So it's extremely important that we move forward having these elements in place.
Yeah, and maybe to add a couple of things that I think that would help a lot, like pushing forward these sort of solutions. And I'm thinking like from a developer perspective now, like where are the challenges and what creates like more difficulties to always like keep moving forward. So one of them is that this comes from clinical, no? Like at the end, the problem has to be a clinical medical problem. It depends on the context of the solution, but it clearly coming from a need that has to be identified from the clinical work. But also for this to be possible, we need to create and provide evidence, and then on that creation and provision of evidence, this cannot happen like separated from a healthcare system. So in that sense, anything that is co-created, any sort of support on clinical studies, on how to build that evidence, I think it's something that would reduce a lot of the challenges that are associated with this type of innovation. And then a different one is, thinking about the AI Act, like it's something that I keep hearing is that, the issue may not be, is not that there is regulation, it's also the uncertainty that is coming with it, like not knowing exactly how, what's the impact of what's coming on the solution, then comes with then it's a risk for many things. And then I think that this is another area for which across private public collaboration is certainly going to support that this innovation, it makes sense, and then it's funded and then keeps moving forward to impact both sides of the world.
Well, thank you, because this is like organizations like AI for Good help us to spread the word, so that together, united and with impact in the whole value chain, all working, we can, reduce this uncertainty that you were saying, and take into account all the legislation that there is as a backup of all these models, and more that will arise. So I would like to thank both of you. As far as I'm aware, there are no more questions, but if someone else wants to send us comments, or maybe you want to say something else regarding the topic today, Albert or Juan, please feel free.
Well, I just want to thank you and ITU for organizing this session, also for having Juan as a companion for this particular session, because I think it really represents not only him, but also many others who are basically working very hard towards responsible AI. And we need to make sure that the great majority of people work towards this goal, because at the end of the day, what we want is technology to help us and to make sure that everybody gets the benefits of technology. So it's one objective. It's not an easy one, but at the same time, we know that we need to make sure that we comply with the current legislation, and that ethics is not a complement, is always something that makes our systems much better. So yeah, we'll leave it here, but we are more than happy to get any questions that you might have, and we are always happy to respond to these questions through the sort of usual channels. Thank you very much.
Thank you so much, Albert.
Thank you. I was gonna add that last part, Albert. First, thank you. It's been a pleasure to co-participate on the webinar, and then I think that beyond our professional duties, we too are interested in AI, responsible AI, and healthcare too. So I would encourage anyone to do not hesitate to approach us for any question at any moment.
Okay, so have a nice afternoon, and we keep in touch talking about all these AI and healthcare topics. Thank you so much.
Thank you.
Thank you for participating in today's AI for Good session. We hope you've learnt something new, innovative, and engaging in today's event. We now encourage you to continue the conversation on the live video wall in the neural network. Here you can ask questions, like and comment, share links, complete the poll, connect with interesting profiles, or speak one-on-one using the chat and video function. We invite you to explore the lobby, try the smart matching quiz, visit the virtual exhibits, poster boards, the e-shop, and build your personalized AI for Good program. Let's shape the future of AI for good.